If you are having trouble with your eyes or your vision, or you'd like to know how to keep them as healthy as possible as long as you can, you clicked on the right video. Hi, I'm Dr. Cori Stern, and welcome to my channel, Take Control of Your Health. This is my next installment in my series, What's in Your Supplement Cabinet? My top picks for eye health. And today I'm coming to you straight from my couch with my dog, who is laying on my foot, and I didn't want to move. So let's talk about eye health, because I am seeing more and more people asking for help with their eyes. And, you know, I've been in this business a long time, and people have always had issues with eyes, but I am noticing, I am observing it's becoming exponentially worse. And I have some ideas about what's going on, but I feel moved to try to help people to prevent issues from occurring, right? That's always the best starting point, is prevention, understanding what causes problems and avoiding the problem, rather than getting stuck with a problem that you then have to fix. So the eye itself is an exquisitely complex organ. It's very complicated. In fact, your brain is the most complicated organ in your body, and your eyes are the second most complicated. There's actually over 2 million parts to your eye. So that leaves a lot of potential for things to go wrong. So I'm going to just name some of the most common things that people complain about, and then we'll talk about what the risk factors are, and then what we can do to fix it if you already have it. So first of all, I'm seeing a lot of people with cataracts. Cataracts occur when the proteins in your eye lens, and the lens of your eye, start clumping together, and then it causes clouding in your vision. And the only real solution that conventional medicine can offer is surgery, surgical removal of the lens. One of the main risk factors for cataracts is high blood sugar. If your blood sugar is high enough, you're almost guaranteed to end up with cataracts, uncontrolled high blood sugar. But just keep in mind that high blood sugar causes inflammation, and that can cause any of the eye issues that we're going to discuss. So that is probably a very, on the top of the list, a very strong risk factor for eye issues is high blood sugar. And that means that eating sugar causes problems with your eyes. With cataracts, though, also high blood pressure, smoking. Smoking causes a risk factor for anything going wrong with your eyes. Excessive alcohol intake, and then long-term use of specific medications like steroids and antihistamines can actually increase your risk of cataracts. Oh, also statins, cholesterol-lowering medications. The next thing that can go wrong with your eyes is glaucoma, and that's an increase in the pressure, in the fluid pressure inside your eyes. So your eyes are filled with fluid, and when the pressure, too much fluid buildup, not draining enough, there is increase in pressure, which puts pressure on your optic nerve. Your optic nerve is in your brain. It's around here, and it goes to your eyes. And when your eyeballs are having too much pressure in them, it puts pressure on the nerve and causes damage. And that can lead to a loss of vision if left unchecked. So again, once again, inflammation is probably the most common cause of the most common risk factor for glaucoma. And then, excuse me, so is long-term use of steroids. And the thing is that steroids are usually used to treat inflammation. And oh, he just got off my foot. I guess he was tired of sitting on me. Steroids are used to combat inflammation. It's a vicious cycle. If you eat crappy food, your inflammation levels are going to go up. Possibly your blood sugar levels are going to go up. You may end up in pain. You may end up with inflammatory conditions, which cause you to be more susceptible to eye problems. And then you go on steroids, which cause you to be more susceptible to eye problems, right? There are better solutions. Next, macular degeneration is just what it sounds like. The macula is one of the structures in the eye, and it starts to degenerate. It usually happens in the elderly, so it's actually called age-related macular degeneration. And again, inflammation. It's really inflammation is really the underlying cause of most things that go wrong in the body. Smoking also increases your risk of macular degeneration. And I made myself a note to tell you a story about a patient that came in with macular degeneration and how we made it go away. Diabetic retinopathy, this is inflammation of the retina caused by chronic high blood sugar. Chronic high blood sugar damages a lot of different things in your body. It damages your blood vessels, which can damage and end up causing damage to any organ. It also, damaging the blood vessels also ends up causing damage to nerves, and it starts usually with, little body parts. So the nerves in your hands and feet, fingers and toes, and your eyes. Dry eye syndrome, this is epidemic. So many people have it. One of the things that can cause dry eye syndrome is dehydration, right? It makes sense. If a body part is chronically dry, it could be because you are chronically dehydrated. So staying hydrated is really important for eye health because your eyes are filled with fluid and they make tears. And that all comes from you putting water into your body. Also, fat deficiency. Your eyes really need fat to stay healthy, and especially omega-3 fatty acids. And a lot of people are deficient in omega-3 fatty acids, which come primarily from cold water fatty fish like salmon, tuna, mackerel, herring. But most people end up needing a supplement because if you have a deficiency, you can't correct it with food alone usually. And so omega-3 fatty acids have two primary components, EPA and DHA. And DHA is especially important for your eyes. It's especially important for children's growing brains. It's especially important for people with anxiety. So if you have dry eyes and anxiety, you might be DHA deficient. But guess what? A lot of people with anxiety end up going on psychiatric medications, and a lot of them have a side effect of dry eye, right? Again, one of those vicious cycles. So maybe consider taking a supplement that's rich in DHA, which I'll show you my favorite one in a little bit. Prolonged use of contact lenses can also cause dry eye. You're putting something foreign in your body when you use a contact lens. Not judging, I'm not telling you shouldn't do it. I just want you to consider all the things, right? Because what's the contact lens made out of, and the stuff that you have to clean it with the solution and the stuff that, the whatever eye drops that you end up putting in. And also vitamin A deficiency can cause dry eye. Vitamin A is a very much under talked about vitamin, but we will mention it in this video, and then I should probably do a video just on vitamin A because it has so many important functions in the body that people don't know about. And then you can have these eye conditions that are transient, like conjunctivitis, which is inflammation of the conjunctiva, often caused by some type of pathogen. Usually that's short-lived and it goes away. Blepharitis, which is inflammation of the eyelids. This can be caused by an infection, but some people's the hair follicles from your eyelashes produce an oil. In some people, the oil is too thick, and that can happen when you're deficient in good quality essential fatty acids like omega-3s. So if the oil is too thick, it clogs up the follicles and can lead to this condition that causes inflammation on your eyelids. So conventional medical treatment consists of scrubbing your eyelids with a special brush and soap. But I have people take omega-3 fatty acids, and it helps to improve the consistency of the oil coming out of the eyelids. And then styes. Styes are pretty common, and I'm seeing more and more people getting styes. I had some myself, and I never get styes. I had a couple of styes in the past few months. Styes, again, can be an infection. The most common cause, the most common bacteria is staph. So I usually have patients do hot compresses. This is what I did too. And an easy way to do a hot compress on the eye is to boil an egg or bake a potato and then wrap the egg or the potato with a wet cloth, and you can hold that on the area for 15 minutes. And usually it goes away. And then I think the last condition I'm going to mention is old age farsightedness. Old age meaning, like, most people start getting this at 40, known as presbyopia. It's kind of something like arthritis in your eye in a way, because what happens is your lens needs to change shape based on where you're looking. So if you're looking far away, it's one shape. If you're looking close up, like trying to read, it changes shape. But with aging, it becomes stiff, kind of like your joints, and then it doesn't adapt. It doesn't change shape easily, and that's what causes this blurry vision, inability to see things up close. Now, I'm 61. These are my notes. I can read them very easily with no glasses. I rarely need to use glasses for seeing up close. But that's because I'm following my own advice, and I'm taking some eye supplements, which I'm going to tell you about. Before I do that, though, I just want to mention some other things that you can do to reduce your risk. There's one other thing I need to talk about. Digital eye strain. Digital eye strain is when you're spending a lot of time on devices, and that can cause blurred vision. It can cause dry eye. People blink less when they're on devices, which can also cause dry eye. Blinking less can also, over time, cause damage to your cornea. You need to blink and keep your eyes moist, or your cornea can become thickened and lead to another condition that I didn't even talk about, called keratoconus, and that really messes up your vision. So what can you do to avoid digital eye strain? Make sure you're blinking, take breaks, and wear blue light blocking glasses, which are readily available. You can get them super cheap. I used to wear them every time I did a video, but people were telling me that the reflection of the screen was in my glasses. So I'm not using them for shorter videos anymore. But if I have to stay on on something all day, I will put them on because my eyes start to burn. All right, so now some other just basic things that you need to do to keep your eyes healthy. Stay hydrated. Hello, that's true for any body part. You need to stay hydrated. I have videos about that topic because not all water is equal. There's a lot of misinformation about water. I think I'm going to do an updated quick video on water because it's such an important topic. Eat good quality fat. We talked about omega-3 fatty acids. I have lots of videos that talk about what good fat is. Avoid smoking and over drinking alcohol. That's kind of a duh, but still, you have to say it because it's easy to go into denial about these things, right? And just think that if you take enough supplements and drink enough water, that you could get away with other bad habits. And it doesn't work like that, I'm sorry to say. You cannot out-supplement a bad diet. You cannot not out-supplement a bad habit. Pharmaceuticals. So we mentioned some of the pharmaceuticals that might cause side effects, steroids, antihistamines, antidepressants, statins. And most people who watch this channel are trying to avoid pharmaceuticals anyway. But if you are currently on pharmaceuticals and you need help getting off them, reach out to me, because that's one of the things that I do for a living, is help people not need pharmaceuticals anymore. And then, of course, a nutrient-dense diet to reduce your inflammatory levels and to avoid nutritional deficiencies, which lead to symptoms like eye problems. So speaking of nutrient-dense diet, I want to make sure you know about how you can get your food from a small-scale family farm that grows clean, nutrient-dense food. And there is an organization called FarmMatch. FarmMatch matches consumers to these small-scale family farms, and you can, if you're in the US, you can get your food from one of these places. Even if you are in an area that doesn't have any of these farms, there are plenty of farms that are happy to send you food. So they ship it beautifully in very well insulated boxes with dry ice, and you get it really quickly. I'll put the link in the description of this video. It's farmmatch.com/Dr. Cori. And my name, by the way, is spelled with an I, Dr. D-R-C-O-R-I. A lot of people accidentally put Y. You'd have to talk to my mom about why she decided to use an I, but anyway, I like it. And you put your zip code in and it shows you farms that you can order from. If you're outside the US, I have a different link in the description of this video. The most powerful way to change the world is voting with your food dollars, and I really mean that. Staying healthy, despite what's going on in the world, is the best way to stay healthy. You know what I mean? Okay, so let me go through some of the supplements that I love for eyes, and I have to use my hand here to screen share. I hope Mr. Mino here won't be upset. Give me a minute, but I'll start petting you again, okay? let's start with some of my favorites. Okay, so this one is called Olprima DHA. And what do you think that is? It's really excellent omega-3 fatty acids that are mostly DHA. So great for your eye health. By the way, this is a really clean product. You know that I do a lot of research on all my products. I know exactly what's in them. A lot of people are worried about taking fish oil because of the mercury and so on, or the degradation of the oil. This is an excellent, stable, clean product. Next, I want to show you this one. It's called Eyeplex, and it's like a multivitamin, mineral, nutrient for eye health. This is what I've been taking for years. I think it's why I don't need reading glasses too often. So it does have vitamin A in it, along with a lot of other nutrients that the eyes need, the specific B vitamins that the eyes need. Also the vitamin C, the eyes need vitamin C, choline. I have a whole video just on choline. So I just love my Eyeplex. So when I first started being old, I was taking 2 a day, and now I have to take 4, but I'm maintaining. I'm not like progressively getting more farsighted. The next one is Zinc Complex, and the reason I included zinc is because zinc and vitamin A work together as far as how they affect the eye. And what else is in this product is copper and iron, and your eyes need all of that. And it's the right ratio of zinc, copper, and iron so that you don't have an imbalance. So I told you I was going to tell you a story about a patient that came in with macular degeneration. She was in her 80s. She had diabetes. She had high blood pressure. She was overweight. She was on a lot of medications. And she asked me before she started a program with me, she said, does it make sense at my age to try to do this? And I said, well, if you want to live as long as possible and be as healthy as possible, then yeah, it does make sense. And she said, okay, let's do it. And she completely changed her diet, and I put her on some zinc because she had diabetes, and very often, well, so first of all, the pancreas needs zinc to make insulin. So very often people with diabetes have a zinc deficiency. So I put her on the zinc, and then she comes in, it was maybe 3 weeks after she started. She said, did you give me any supplements for my eyes? And I said, not specifically. Why? You didn't tell me that you had anything going on with your eyes. She said, yeah, you're right. I didn't tell you, but I have macular degeneration, and which was causing gray bars in front of her eyes. So like blocking out parts of her vision. And she had six steroid injections in her eyeballs, which she said were very painful, and they didn't help at all. Like there was no improvement. But she said after 3 weeks on my supplements, the gray bars were gone. It was like completely resolved. And thinking it through, I realized the zinc, which I had been giving her to help her pancreas, also helped her eyes. So think about it this way. If you have diabetes and macular degeneration, you may just be zinc deficient. You know, this is how this works. You correct some deficiencies and stuff goes away. The next supplement that I want to mention is bilberry. Bilberry is a fruit which is fabulous for eye health. It improves night vision. It can help with, actually all eye conditions can be improved with bilberry. And it's also preventative. And it does a lot of other things in the body. It increases your circulation. It helps with recovery, post-surgical or trauma. It helps improve the quality of your cholesterol. It can help with diabetes, with dementia prevention because it increases circulation to the brain. So it's really something to consider if you want to keep your eyes healthy. And I think this is the last one. Yeah. The last one I want to talk about is called RNA, ribonucleic acid. And this is a substance that's produced by your cells that helps with cellular replication, like it's part of DNA, RNA, DNA. But when you spend a lot of time on devices, your brain and your eyes become depleted of this substance of RNA. And that can lead to both eye strain as well as some difficulty focusing. So I actually use it for students who are studying a lot, especially if they're on devices. You get depleted of RNA anytime you're like heavily focused. I've talked about it on other videos. The other thing it interestingly can help with is sleep apnea if it's neurological sleep apnea. In other words, something coming from your brain, a signal that's not getting sent to the part of the nervous system that handles breathing. So RNA is great to take if you have a job where you're spending all day on a computer, if you are studying a lot, if you do presentations, anytime that you have to really, really use a lot of focus and attention. And I take this every day. All right, so that's it. So that's all I got. If you have not yet had a chance to subscribe, I would so appreciate it if you did. I'm trying to hit goals, and I would be very grateful if you would help me reach my goals. If you like the video, don't forget to hit the like button because that actually does help with the algorithm. It helps more people find the information. And last and most importantly, please don't forget to share this with anyone that you know that you think might benefit from the information. If you have questions, reach out to me at questions@drcori.com. That link is in the description of the video. And if you would like a personal health evaluation and get started on a health improvement program with me, we can do that no matter where you are in the world. I'm available and I'm here to help you improve your health. So I hope you enjoyed this video and I will see you again soon. Until then, please stay healthy.